Hi, I'm Dr. Carine of Carine Pediatrics. We're here with the COVID news of the week. Well, there's so much happening. I have to say, watching the news is a little bit nerve-wracking. It's difficult. So I try not to watch, network coverage of COVID because it is very confusing. And so I'm going to try to help you sort through what is actually happening with the disease. One of the things that I keep talking about, and I'm just going to say again today, is that when you hear our leaders talk about COVID, they use terms like slow the spread and flatten the curve, right? At no point has anybody said we're going to stop COVID. And I say that because it's really important for you to know that I hear people a lot of times saying like, when all of this is over and when we're safe to come back outside. And I just want to remind you that this virus is going to be here for a really long time. So we're going to have to shift from being afraid of the virus to figuring out how to confidently live in the world around us. So that comes to my first point, mortality rates. As you look at data and people keep posting data and they give you numbers and you come on TV and they're like this many cases and this many deaths and this many ICUs, it really makes your head kind of swim and it sounds really scary. People have said for a while that America is experiencing somewhere around a 5% mortality rate, which is lower than the rest of the world. There's a lot of reasons for that, basically because we have by far the best medical care of most countries. So our access to medical care, our number of ICU beds actually hasn't been overwhelmed in all of this, and that helps our mortality rate. So even in the hardest hit cities like New York, they have been able to service the patients, albeit in a very stressful way. So what is our mortality rate? Well, if you remember, and we'll brush off our brains from fractions, that you have two numbers in a fraction that creates your percentage. Your top number is the number of deaths, and the bottom number is your number of cases. Okay, so right now what they're saying is that top number of deaths are people that were identified as COVID and have died. Some of those patients are hospice patients who were identified as COVID but were at the end of their life anyway. Their cause of death is listed as COVID, so that's a little bit odd. We also have patients that are dying at home or dying of other reasons that never got tested for COVID and they're not included in that number. So your top number, your mortality, like the actual deaths, also has some variation, although it's closer. We're pretty good at identifying COVID deaths. It's important because some people are being critical of calling a death at home or something COVID, but there really is some amount of truth to the fact that there are patients that have not tested positive for COVID that we as medical professionals are pretty confident that's what happened. What we'll really need to do eventually is figure out what the death in March and April was compared to a normal March and April, and that will give us a better idea because there's also collateral deaths when we talk about that, like suicides from being locked up at home or heart disease that was unaddressed. So we have both the actual people who died of COVID, the disease, and then we have people who died of what I would say the pandemic. And those numbers are high. Then we have the bottom number, which is the people who got the disease. And that number is the hardest number. So although we have some variation in the top number, we have a lot of variation in the bottom number. As a lot of you know, we are not testing everyone. So that bottom number is people who either are sick enough to be in the hospital, healthcare workers that we are monitoring to see if they are positive. And then you're starting to see this week some data coming out of places like prisons or nursing homes, places where they're doing what we call monitoring of asymptomatic people. So even that bottom number isn't all symptomatic people, because you could say it was the number of people who were sick enough to go to the hospital and died, but that's not even true. We have patients who are completely asymptomatic, like the prison here in Ohio that we grew numbers on, or the number of sailors that were on the Roosevelt that we tested as well. So we're doing some of this monitoring to say, what is that bottom number? And what we're finding is that bottom number is very, very big. So when you lump in what we're figuring out on how many patients have asymptomatic carriage and how many people are running around that were positive that we did not actually gather in our data collection, we start to see that that ratio, that top number to the bottom number, gets really different. So instead of identified cases versus deaths, which is around 5%, we also have all these unidentified cases, and that number starts dropping very fast, and our numbers are looking to be well under 1%. like 0.1 maybe, or 0.5%, very small amount of people who get exposed to the virus, catch it, will die from the virus. That's not evenly spread across the population, of course. So you keep hearing that those over 60 are very high risk, and that's very true. And all the numbers as they come out are bearing that in mind. Almost no pediatric deaths, very few from 18 to 40. We start to go up between 40 and 60, and then we go way up, like 70, 80% of the deaths are people over 60. So those numbers are still playing out. They're the same as we thought originally. So what does this term herd immunity mean? And you're hearing some of these odd, news articles about how, what percentage of the population have already got it, that the cities are doing monitoring of people to see if they're positive for having previously gotten COVID. This is fascinating information, and this is something that I think was really important in the news this week. I want you to understand. When you fight an infection, your body forms what we would call immunoglobulins to the memory of that infection. Those are called titers. Those are actually easier to test than the nasal swabs for the virus itself. And we do that all the time. We test it for lots of things. It's how we measure if your vaccines work. It's how we measure if you have autoimmune disease. Those are titers as well. It's how we measure if you have, antibodies to your islet cells that cause type 1 diabetes. Titers are something we measure all the time in every lab across America. So coming to a lab near you soon will be the ability to run that lab. Some people have been talking about whether they're accurate and how this and that. The good news is they are not difficult to do, so approving them quickly will be easy for the FDA to do. So LA did a monitoring of a random sampling within their city, which means that people who got blood for some other reason, they were like, well, while we have this tube of blood, we're just going to take a drop and see if this person had COVID. Those are blinded. They don't even know who it was. They don't even notify the patient. They just say, of the samples that we tested, the numbers out of LA were around 5% of the population had already caught COVID at some point and didn't know it. They then, in New York, went into grocery stores and got volunteers to give a drop of their blood, and they found out that in the city, 20% of New York City residents have shown now that they have previously fought COVID. That's great news, right? Because then that number of people who've caught the disease is much larger on the bottom. It means that lots and lots and lots of people, well over 95% of the people who catch COVID, sometimes don't know they had it or had a mild case. And that's fantastic news. So you keep hearing like, well, so are we going to get herd immunity? Is there a point in which so many people are going to get it that we aren't going to have COVID around anymore? There's still a lot of information about that. This is way too young of an illness for us to know for sure. But for typical illnesses, we reach herd immunity somewhere around 60 to 80% of the population having had it in the past. We are a long way away. So we will be monitoring that. The government will be monitoring that. They will be thrilled when we start to hit close to those numbers because that means that the illness will start to die down a bit, but we are nowhere close. And let's go back to our statement of slowing the disease and flattening the curve. By locking ourselves in and by protecting ourselves in this short term, we actually have prolonged the time in which we will get to that herd immunity. So there's no illusion that if you go back out, you're going to be protected by this notion of herd immunity anytime soon. We have a long way to go because even in that metropolis of New York City, with people circulating around and lots and lots and lots of virus, we are only at 20%, and we really need to be up more like 60 to 80 to start to see some benefit to the fact that we have herd immunity. The majority of Americans, especially in Ohio, have not had this illness. And so I get a lot of questions of like, is that the cold I had in February? Or is that the cold I had in January? And I think for some people that will be true that it was the cold they had in February, not the cold they had in January, but it's gonna be a rare number of people. When we look at that surveillance data out of LA saying only 5%, LA is near the coast and there's lots of people from China and their numbers are very low. We've locked down so efficiently that the majority of people you come in contact right now do not currently have COVID and have not previously had COVID. We are still a population in Ohio who is completely not immune to this illness and are vulnerable to catching it, all of us right now, if you look at the numbers. So, and there's that little blink of good news we keep hearing, and it is still the same that children are doing very well. So that's great news, and we're going to keep that up. So going forward, as we go out into the community, which is coming, remember we're gonna go out, we are not gonna be immune. We circle back to that idea that we really need to be wearing masks in public. We're wearing masks not always for ourselves, but for other people. And so what you need to realize is this is really an issue of like politeness and social culture, that we need to be okay with wearing masks. I want everyone wearing masks in our office. I'm still seeing a lot of people without masks here, and it's very important. We're going to start handing them out. If you don't come in with a mask, we are going to ask you to put one on. I don't want them coming off during visits. I know it's awkward, but everyone leaves their mask on the whole time they're here from start to finish. The other thing that I wanted to mention is right now in Ohio is the lowest number of COVIDs we're going to have for a very long time. We are safer right now than we will be in 2 months. So when people say things like, we're gonna have another spike, we are not gonna have a New York spike. We're putting too much social distancing in place. We aren't running subways or having football games or big parades. That's not happening right now. And so we will not have that rapid spike that New York has. That's not going to happen. So when you hear there's going to be another spike, we are not going to be New York at any time. However, we are going to have more cases. Everyone has been locked up right now, and pretty effectively so. So as you go about your business, it's actually not very contagious right now, and we will become more and more contagious actually the longer we're out. So what does that play out with summer? We heard the news today that we have like sunlight kills the germs and heat kills the germs. So does that mean we won't have it in the summer? We will still have it in the summer. But the great news is it literally dies in 30 seconds in the sunlight and heat. So when we're breathing it out, when we're outside, if we're in the sunshine, we have our 6 feet, and we're not kissing somebody or right up in their face, we're not going to spread it to each other, which will be a great way for community control. But we will still spread it to each other in close contact, which goes back to the social distancing. So you can't stop the spread of this virus just because it's summer, but you can change how fast and easily it spreads on outdoor playground equipment or pools. And it'll be interesting to see what our governors and stuff decide about what can open and what can't open. But we will continue to spread. So if you are trying to get healthcare for your family, whether it's an adult or a child, now is the time to get it. I've talked to several families this week who have been withholding getting their children's regular blood work, or maybe they need to go somewhere and get some medical procedure that is still open. A lot of them aren't, but if they are, now's the time to go. The hospitals are empty. I mean, when our patients are going over to get blood work, they're the only person there. Nobody has it. The pediatric hospitals are dead. It is a very safe place, and it is actually safer right now in a children's hospital laboratory than it is in the middle of RSV or flu season, which is kind of a little bit of a disaster sometimes. So if you want to get something done for your children, I actually recommend that you do that right now. It is the safest time, and it will be the safest time on for probably the next 4 to 6 months. So everybody get your medical care. We are going to be doing this for the long haul. Withholding medical care for yourself or your adult family members is not a good idea. I very much worry about, especially our older population, not seeking medical care. If your doctor isn't returning your adult phone call, because of course we are, but if you have a family member or a grandma or yourself and you want to see your doctor and they've completely closed and they are not answering your phone calls, you need to bug them more. Or you need to find another doctor, because we have lots of telemedicine available. People should be able to examine you if you need to for minor issues. We have the available protective equipment for ourselves to do that when we need to, and your doctor is no different. So make sure that you seek medical care. Don't delay it. Don't let yourself get sicker just because COVID is here in place. So I hope this helps. We are always here for more news and help you sorting that out. I've been answering a lot of questions on telemed, and that's fine. We are here for you and your family whenever you need us. Thank you.